Hi, I'm Dr. Elizabeth Livengood. I am an integrative primary care doctor in Arizona, and I'll be talking with you today about cutting-edge primary care applications of peptides. Today, I would like for you to understand 4 different types of peptides, recognizing their limitations of practical use, understanding at least one mechanism of action, as well as recognizing the difference between a therapeutic peptide and a biologic medicine, since they have similar roots, clinically speaking. And you will also understand the synergistic use of peptides with other medicines. As of right now, we have more than 80 peptides in clinical use. Now, there are 3 different types of peptide-ish molecules. Those would be small molecules, less than the 500 Daltons we saw with peptides, very agile and easy to use. There's peptides that we just described, and then there's biologics that I alluded to. Those are usually larger. So let's look at some pros and cons for each of these. Good thing about peptides is they're very specific. We can cut them into small enough sizes that they have a very high affinity for certain enzymes, certain pathways, and certain receptors. They are also ideal candidates for inhibiting protein-to-protein interactions because they can mimic those protein surfaces very, very specifically. So they compete for binding, and we know exactly what they would be good at doing. And then we can also eliminate some of the side effects and immunogenicity that's associated with larger and less specific molecules. There are other types of peptides. They can be naturally derived or human-derived, as well as synthetic. So let's get into some specific peptides that you might be using in your practice.